Hello, everybody. This is Tobin Arthur, the CEO of AngelMD, and I am joined today by a really neat company called SmileSnap. And two of the guys behind this company I want to introduce. I want to start with the CEO, Greg Pellegrom, who's going to introduce himself, talk about the company, and introduce Dr. Waldman, who's working with him. Greg, welcome.
Hey, thanks, Tobin. Appreciate the opportunity here. Yeah, my name Greg Pellegrom. I'm the co-founder and CEO of SmileSnap. We're a virtual consultation and appointment platform for dentists and dental specialists. We launched the software back in April of 2019, so just over a year ago. The beauty of this platform is it allows doctors, dentists to give better and greater access to their practice around the clock. And from the patient side of it, if you're interested in dental services, it's as simple as getting to the practice website, answering some questions, filling out your contact information, and then taking 5 photos of your teeth, submitting that, and the dentist will get back to you within usually 1 to 2 business days with information specifically to your case. So it's really a great way to digitally engage and interact with the practice. Very convenient, very transparent. We felt like this was a great platform before COVID hit, but obviously during it, as a lot of practices have been forced to close, there's been a tremendous number of applications we've learned along the way for it as well. And it's here to stay. So we're excited for the growth that SmileSnap has seen over the past 90 days. And the opportunity going forward. So thanks, Tobin, for this platform to share our story.
Yeah, absolutely. And I'd be, so from the patient's perspective, it seems interesting. It's not intuitive necessarily how I would necessarily see and interact with my dentist through a teleproduct. So Dr. Waldman, thanks for joining us. Love to hear just a little bit about your practice and then, just your thoughts on this whole evolution.
Absolutely. First of all, thank you so much for having me. It's a pleasure to be here. I'm an orthodontist. I've been in private practice in Beverly Hills, California since 2003. And my practice is kind of, I would say, fairly representative of most orthodontists in the country. We see a mixture of kids, adults, do different techniques. What's really changed, though, is the nature of our business over the last few years. In our industry, we've seen a lot of infringement in orthodontic private practice from corporate entities and direct-to-consumer entities. What this has done is really pivoted the consumer's perspective that they can access dental products, dental services, particularly in orthodontics. It's very endemic in orthodontics, from home, literally buying treatment from home. And it's kind of changed the mentality. So about a year ago, well, a little bit more than a year ago, March 2019, we decided we were going to start offering in our practice virtual consultations. Obviously, the patient eventually needs to get to us to do treatment, but we thought it would be useful to have a way to engage the patient where they're at, on their smartphone, on their computer, at home, to allow them to start the conversations that would allow them to learn about the practice, for us to learn about them. And ultimately, the more information we have for them coming in before they come in, from industry kind of language point of view, the higher their conversion to orthodontic treatment would be, because they are simply a better educated patient. We also realize it's a great communication tool. Much of what we do is kind of conversational and discussing, and so much of that can be done with a virtual tool to save chair time and to make the economics of the actual physical practice more efficient. So we started on our own, using our own kind of homegrown, I'd call mom and pop solution on our website. Then I had the very fortunate occurrence of meeting Greg Pellegrom and the SmileSnap application at a professional meeting I was at in Dallas, actually, in November, I think it was, Greg, yeah. And I saw this product. I told Greg, this is fantastic. It was exactly what I was trying to achieve, just in a much more sophisticated way. It is a piece of software, but it starts as a widget on our website, and this makes our website sticky. So suddenly your website goes from being informational to actually being a business kind of magnet, if you will, that when people are surfing around, they get from Yelp, Google, this and that. Suddenly, they're not just looking at your site, oh, I see what he has to say, and then moving on to see what else someone has to say, but actually getting them to land and to interact and to send us the photos and to do a free virtual consultation. And that has really changed the game. We've done, I think, probably now close to 500 virtual consultations in the last year. And about half of those now with SmileSnap since we started that about, what was it, about 7 or 8 months ago. At the time I was doing it, my friends kind of like, what are you doing? You know, it was kind of new, it was strange. And as soon as COVID hit, it was obvious to me, it was already obvious that this was the future of orthodontics. This was the future of how we're going to engage with our patients. That Greg had cracked the nut on what that means to be consultative and engaged with an online patient in today's world. It just, people weren't seeing it. You know, they weren't seeing, why would I do that if they can just come to my office? Well, it took the entire world shutting down for people to see that not only you can do it, but you should be doing it, because it's actually, in today's world of digital engagement, actually a better way of doing business. And we've kind of coined some terms around it. You know, we call it the inversion of the new patient funnel, because the old funnel was you open it wide, try to get as many consult seats as you can in your office, get as many people in there. You don't know who they are when they call. You don't know who they are, but they come in and you try to start as many of them as you can. Now we're inverting that funnel, making that entry point a little more narrow, that when they do pass through, they're going to go right into treatment. And so that has allowed us to improve our conversion rate. So this is not just for show or to be cool, or, you know, this actually is a tremendous tool to improve the efficiency and the efficacy of our whole new patient process. And even though we're back, I'm in my office now on a blank wall, but I'm physically in my office today. We're very happy to be back. Our patients are happy to have us back. But one thing that we will never go back to is doing only physical consultations again. And we're just rolling this out now, not only for new patients, but for existing patients, for video consults. And SmileSnap is really very quickly adapted. And I have to give kudos to Greg as well as to Jameson, who's on the technical side of the application, who's done a beautiful job at developing very quickly not only the photo application that Greg discussed, but a video application that essentially rivals Zoom in its kind of its application, its usability, its kind of a productivity. And we have been just exploiting that. And we have really found that this tool is just absolutely something that we cannot live without. And we're confident that actually once other dentists and orthodontists get their hands on it and start to experience that with their patients, they will feel very much the same.
Talk a little bit more about that in terms of also not just from the marketing perspective and pay coming in, but I'm suspecting, you know, you mentioned earlier, you know, chair time. Has this reduced or changed how you think about the workflow and the throughput in your practice as well?
Absolutely. Particularly with the new patient process, that our goal is essentially to complete as much of the process prior to the patient physically coming in. And you can only do that if you have virtual tools, whether it's photos, videos, whatnot. And so that has basically, I can only speak within orthodontics because that's the only specialty of dentistry I've ever practiced, but typically you'll have a consultation that might take an hour to an hour and 10 minutes where you're taking photos and you're having discussions, you're making decisions, and there's questions being asked, and then, you know, and examinations, and then kind of, you know, finances being worked out and things being started and done. It's a lot to do. And so, and then you sometimes go through that whole thing and spend a tremendous amount of very valuable doctor time, and yet the patient still chooses for whatever reason not to start. Why? Because in that hour, we weren't able to figure them out. We weren't able to give them what they wanted. We didn't have enough back and forth, enough preparation. And so now what we're doing is taking all of the conversational aspects, the questions, the financial aspects, getting that done for the patient before they come in. So that when a patient comes in, it's the start treatment, meaning they're going to get an examination, because that I can't do virtually, you know, check their gums, check their jaw, check the teeth more carefully. They're going to get an examination, and they're going to take whatever diagnostic records it takes to then get them from that point into treatment. and they're going to sign a contract if that's not already done through the virtual process. And so by doing that, we're being much more efficient because the person who does come in, again, is a higher percentage of starting. We're finding an extraordinarily high conversion rate. 80 to 90% of those patients are starting. It's like very rare that they don't. Maybe something came up that we didn't realize in the virtual, maybe, some other dental needs they need before they can start, something like that we didn't see. Can only detect that on an exam. But for the most part, they're starting. And of course, it's reducing the amount of time that we're actually scheduling for these visits. We're scheduling half of the amount of time now. So we're able to see more of them. And the virtual part of it is much more flexible because that can be done by a well-trained auxiliary during non-doctor time, or if the doctor needs to get involved in that conversation, which I often am doing to raise the quality of the virtual and video experience with the patient, that can be done during lunch. It can be done at the end of the day. It can be done where it doesn't interfere with those very valuable kind of high staff needed times during the day.
Talk a little bit about the business model. How do you roll this out efficiently? How do you get that cost of customer acquisition down to a number that's palatable?
If I go back to March 1st of 2020, we were 11 months since we had launched the product, and we were sitting somewhere in the neighborhood of about 80 paying customers. And over the past 90 days, we've now exceeded and are approaching 850. So we've had explosive growth. And our annual recurring revenue has gone from about 85,000 to almost 1.5 million in that time. So we really have gotten that traction. Like, I feel as though we've now crossed that chasm. We're entering those early majority customers of ours. And we've seen a little bit of a slowdown with doctors getting back to work, but we expected that to happen. So we're really gearing up for, once their practices are back open and running normal, right? How do we take SmileSnap to that next level? We've got lots of great ideas and ways to do that.
It's honestly, out of all the software that I use, has, in terms of the output of what we get from it, probably the highest value of like anything I've ever used, because this translates into direct sales. And the other thing, as Greg mentioned just now, which I didn't even talk about before, is that even beyond new patients, it can be used as a tool for any kind of conversation, any kind of follow-up, anything that you would have maybe just used your eyes for, but not your hands in your dental practice, which is a significant number of appointments throughout a week. That can be done virtually, and those are just so much more convenient, so much more. So you get a lot of bang for your buck as a doctor from all these different perspectives.
Just one little question. Greg hit on something. I'd just be curious to your experience. So you're in Beverly Hills, in LA. LA has been, just recently starting to open back up. What's that been like, for you? What did that 60-day period look like? Were you completely shut down? How are you leveraging this during that period? And then, are you kind of getting it back to some new normal? What's the experience been like?
Well, I think that, we were shut down by the county, city of Beverly Hills, state, I mean, the whole shebang. We were open for seeing emergencies, and that was, we had to define what we consider to be an emergency in orthodontics. This has to be, pretty significant. So we were seeing some patients, but for the most part, in terms of our new clients, new patients, if not for SmileSnap, we literally would have been shut down, literally. But actually, we were able to start some patients during this time, I'm happy to report, because we had this kind of lifeline and the ability to connect. And actually that's why Greg had incredible hockey stick growth during this time, because you didn't have to be a genius to realize that you needed a way to continue your normal consultative. And there were people who were still interested in treatment because they were told by their dentist a few weeks before that you need a consultation. So that interest was there. How we were going to do it and the concepts of actually seeing the patients, we weren't sure yet. Now that we're back in the office, we're not back to normal in terms of the volume of patients that we're supposed to be seeing with regard to social distancing and careful sterilization. But we are seeing a somewhat normal schedule. Our consultation schedule has been incredibly effective because we're incorporating now all these, video consults. And I'll now have a day where instead of having maybe, 6 or 8 new patients, I'll have maybe 3 or 4 physical patients, I'll have 2 or 3 virtuals, and I'll have like 6 or 7 sets of like, photos I need to check. So suddenly it's a much greater diversification, and all of that does lead to a greater efficiency. And we've actually seen a very strong return to normal business numbers in terms of production this month. And I attribute that mainly to our ability to really kind of pivot and utilize the technology, knowing there are still people who are still uncomfortable coming to the office, even though we're open. And there's some people where they're so used to now, the patient psychology has changed. They're so used to doing everything on Zoom now. It's like the Zoomification of everything, that it doesn't seem strange anymore. It seems the most natural thing that you could do, to have a first meeting with your doctor by video chat. It's convenient. I mean, for me, we have a lot of kids in the practice. The hardest thing always as an orthodontist was like getting both parents in the room to decide on something. Well, now you can meet them at 5 o'clock when dad's home from work anyway, and I finish patients and I'm relaxed, and I can have a 10-15 minute Zoom call with both parents. And everybody, all the decision makers are in the room by definition. And so that is changing how we practice, even when we're still here. Even now that we're back, I should say.
We are hands down by far the leader in this space when it comes to the tech stack and how this platform is built out as a SaaS model. I've really been shocked by the growth that we've had, and that's going to continue, because most physicians and dentists out there, they realize that telehealth has been put not only on the map for you as providers, but in the minds of the general public. They've all now heard of virtual this, or Zoom that, or whatever that might be. So when they come to your website, when they hear about your practice, when they're learning, they expect you to have these as options. It doesn't mean that they're going to use them, right? The analogy I've been saying is, I used DoorDash for the first time during COVID, okay? When restaurants open back up, am I going to use it? Yeah. Every time? Probably not. But I am at least going to pick and choose where I'm going to use that. And therefore, I think that dentists and other specialists absolutely need to implement this type of technology, not just putting the software out there, but really designing and developing their workflow within their practice, like Dr. Waldman has done, to get the most out of this digital platform. So yeah, we're looking to raise money and put that money to work so that we can acquire more customers while the opportunity is red hot.
We'll go ahead and end it there. It's as good a spot as any. Greg and Dr. Waldman, appreciate you both spending some time. It was great to learn more about the business. You have a great future ahead of you. And Dr. Waldman, really appreciate your perspectives as a clinician.